Thank you, Chair Bernowski and members of the committee for holding this hearing on this very important joint memorial. Kathryn Lewandowsky here, retired registered nurse, Whole Washington Board Vice Chair, and a constituent of Representative Lowe in LD 39. We understand that there's a lot of work to get to where we need to be. I used to have a goal of riding my horse 100 miles in 24 hours. How does one do that? 10 miles at a time. And every 10 miles you stop, look at your progress, examine your horse, make sure everything is in place and looking good, and then you get started on the next loop. This joint memorial is the next 10 miles that we must traverse to reach our goal. Too often in my nursing career, I saw young people feeling invincible. They don't need health care, they're just fine. And for most of them, that is true. But for a few of them, that is not so true, and for them, it can be devastating. Then there are many of us who do just fine for many years. We work, we save, we invest, but too many times what I observed in my nursing career was devastating healthcare tragedies happening to hardworking people. People thought they were well covered, but once ill, discovered all the holes in their coverage. Then I watched a ruthless, predatory healthcare system consume all of their life savings. Frequently, one spouse used up all of those savings, leaving the other one destitute and alone, with nothing to pass on to their children and grandchildren. Often I see many people refuse treatment in order to protect those assets that they'd hoped to be able to pass on to their children. Why should we do this? We can't afford not to. And nobody has any intentions of copying any kind of failed healthcare systems from around the world. We are trying to look at the systems that have worked, that pay much less money per capita than we do, and have better results. Please pass this important joint memorial.